Obviously, Udo is an investment that you and your facility have put in. But if I understand it right, you've been able to reduce overall staffing because of what Udo is doing for you. Talk a little bit about that.
No, you're exactly right, because I haven't used staffing agencies since I've used Udo.
Wow.
So those days are gone. So I have my staff, and we have a lot of longevity CNA and nurses, and they've kind of stayed loyal with me throughout this pandemic. But Udo has just really helped us so they actually enjoy their job. And so they actually are focused on the patient, trying to get them better instead of doing the orientation and all the other distractions basically, but need to happen because the family's in the dark before Udo. But now with Udo, they get that information. They just are more complimentary. And so the families are grateful. We're bringing in donuts and saying thanks for the good care that's happening. We see that quite a bit, actually more now than we did before Udo.
So staffing agencies, I've heard from multiple administrators that they absolutely hate these staffing agencies. They
Sure.
are so against them, and it's causing an increase in their overall payroll. And it's not like you can just raise your rates to get to make your bottom line happen. So you're not using staffing agencies because of utilizing Udo. Am I hearing you right?
Yeah, no, that's exactly right. That's our staff, we don't need the staffing agency. And another kind of a negative about staffing agencies is these people aren't trained. They're coming in, and so your staff, not only now you're working a little bit short, but now you're trying to train somebody to help you through it. And they're usually, no offense to them, they just don't know our systems. You have a CNA that's worked for me for 5 years. She knows what's going on versus someone just started one day. So there's a huge,
so you're saving money because you're not having to pay that staffing agency to help you, but you're also saving money in terms of don't have to, you're not turning people over, and you also don't have to train somebody new every time they come in.
Yeah, you're exactly right. Turnover is a huge staffing. I mean, that's a huge cost when you're constantly training staff and they come in and they're bombarded. If they would just, most people come into healthcare they want to take care of somebody and help them get better. And so if a CNA or a nurse comes in to have that opportunity and they get to do that, they love it. But all the in-between where the reaction to healthcare comes in, where they're reacting to a family member being upset or reacting to a situation they're not really sure the answer is. They're trying to do a mini care conference, and she transferred really good, and that's all, the CNA knows. But they're having to do that because that's how it was before Udo. Now with Udo, they get to be focused on the patient. They get to see that progression of that patient getting better, and they're actually getting high fives from families saying, "Good job, thanks for the care."
So you've really changed the culture overall with the staffing.